Dr. Davidhizar, I want to talk about something which maybe is not your everyday dealing with, and that is gum disease. Having periodontal disease, gum disease in the mouth. And let me state this a certain way. Most dentists, quite often, they say that when you have gum disease, you'll lose your bones, you'll lose your gums, you'll lose your teeth. Bad thing, no doubt about it. But the fact is, dentists do a hell of a job in putting implants in it, and great dentures with half implants and stuff. Anyway, the mouth can look gorgeous, and as long as you spend money, again, with teeth. But to me, if a person, it takes 2 to 5 and more years to start losing those teeth with a gum disease, during that time, it looks to me that a person has an infection in his mouth, and slowly, minute by minute, the infection at the gateway of the mouth drips into the blood. And it ruins the liver, it ruins the kidney, it is cause for heart attack, cause for strokes. In fact, in California here, there was apparently a baby stillborn because they found that yellow, ugly, reddish pus from the gum disease in the placenta. And apparently babies get born, and I know that you're very familiar with because you have done OBGYN work, that you're very familiar with babies and moms and pregnancies and that, moms who have an infection in their body, gum disease infection, can easily have a tendency of getting a premature birth with an underweight baby. Is what I'm saying here totally off the wall and just like has no bearing medically, clinically, the way you look at it, or is there something to it?
No, there's something to it. There's been a lot of research lately, especially for heart disease and those kind of problems, that gum disease is a big problem. I've seen a couple of in my cases in my practice where people had this chronic illness, kind of low-grade fever, often I couldn't figure out what it was. We did all kinds of tests. Eventually we had them see a dentist, and sure enough, they had an abscess. Wasn't very big, wasn't even giving much pain, but it was enough to cause all the problems. So there is, taking good care of your teeth there's a lot of benefits from that, not just for your teeth, but for your whole body, to keep it healthy and make sure you don't have other complications from the bacteria. It's really the bacteria that causes the problem from your gum disease. It gets in your circulation eventually and causes many problems.
Right. So when that yellow, an infection by definition, in my opinion, is an infection because it infects other body parts. So if you have an infection in your mouth, which is huge, some dentists say that that infection is almost as big as your hand. Imagine somebody kind of bleeding and having a heavy open rash on the hand or somewhere on the leg. Literally instantaneously, the person would go to a doctor and try to get it fixed. But apparently, people don't do that with their gums. And thus they get, a lowered immune system, because, there's an infection and it lowers the immune system. So you agree with that? You think it's something people should fix?
It is.
So why is it that many, that very few doctors I have seen actually go and tell their patients and say, look, it looks like you're having a gum disease here, because on an average you can smell it literally. You know what I'm saying? But at least you can, with a little bit looking, when you do the tongue depressor and stuff, you can see that, wait a minute, this isn't quite clean. You guys are doctors. Why is it that few doctors tell the person to go and get that fixed? Because they would surely do that with any skin rash they have.
Yeah, it's true. It's funny how people don't think their teeth are as important as the rest of their body, it seems. Sometimes I think it's cost. A lot of people don't have dental insurance. And a lot of people are worried about getting those shots from the dentist. They all hate those. So some people are trying to put them off for lots of different reasons that don't make much sense. Because eventually if you put it off, it's going to be a lot worse fixing it than if you fix it right away. I don't like those shots either, but I always go to all my dental appointments because I know the alternative is not good. And so a lot of people don't seem to take that attitude, and that's a part of the issue. But when I see people in my practice that looks like they have gum disease, depending on what it is, sometimes I'll just put them on antibiotics, have them come back and check it, and then tell them to go see their dentist to make sure everything else is okay. But it's amazing how many times I do find gum disease when I'm examining people, and they aren't even complaining about it.
Right.
But it's there when you look for it.
Right, because it doesn't hurt. So you do agree that a gum disease is an infection, and it does affect the rest of the body, being it by a lowered immune system. Because it's like soldiers, you're having all those soldiers fighting this disease here, and then if you have something else like a flu coming up, which we talked about it, with no doubt there are going to be less soldiers available to fight that flu. A little bit like currently we're fighting a couple of wars in our country here. I mean, a third one, how many more soldiers we have to send there, right?
Right. Yeah, anytime you have an infection, it can affect your immune system throughout the rest of your body, and you just don't heal as well in other places too. Good.
All right, so I just wanted to know from a medical doctor's opinion about the gum disease, or to just is it just dentists who say, look, this is a bad thing? But it is. It is an infection, it is a bad thing, and it should be fixed, otherwise it affects the rest of the health.
Right.
I appreciate your candidness. Thank you very much, Dr. Davidhizar.
You're welcome.